Hi everyone, I hope you will find this video in good mental and physical health. This is Dr. Samir Said RPH and today we are going to discuss 6 supplements that can be used to relieve from GERD or acid reflux. So I request you to stay connected up to the end of this video. So let's start our discussion. The first supplement that we are going to discuss today is betaine HCl with pepsin. Betaine hydrochloride is a compound used to increase stomach acid. Low levels of stomach acid may slow digestion and absorption of the nutrients, as well as causing a range of side effects including heartburn, stomach pain, and acid reflux. One study in 6 people with low levels of stomach acid showed that taking 1500 mg of betaine HCl increased stomach acidity. Betaine hydrochloride is also paired with pepsin in many supplements. Now, what is pepsin? Pepsin is a digestive enzyme in stomach acid that breaks protein into smaller units. One 6-week study in 97 people with indigestion found that taking pepsin combined with amino acid hydrochloride significantly reduced symptoms like stomach pain and burning. Some studies indicate that betaine HCl may increase stomach acidity in people with low stomach acid, thereby reducing symptoms of acid reflux. Pepsin may also relieve indigestion symptoms, but more research is indicated. These are the natural sources of betaine, which are beetroot, cereals, and fish, etc. Second one is B vitamins. Some research suggests that B vitamins including folate, riboflavin, and vitamin B6 may help treat acid reflux. In fact, one study found that increased intake of several B vitamins was associated with a lower risk of reflux esophagitis, a condition characterized by inflammation in the esophagus often caused by acid reflux. What's more, greater intakes of folate and vitamin B6 were linked to a lower risk of esophagus cancer and condition called Barrett's esophagus, both of which are potential complications of long-term GERD. Melatonin. Melatonin is a hormone that's primarily responsible for regulating the sleep-wake cycle. Although it's typically used to treat insomnia and improve sleep quality, some studies have found that melatonin may also aid in the treatment of acid reflux. According to one study in 36 people taking melatonin either alone or with heartburn medication for 4 to 8 weeks reduced symptoms of GERD. What's more, some studies suggest that melatonin may help protect against inflammation of the esophagus, which could prevent long-term health issues. The next one at number 4 is Iberogast. Iberogast is an over-the-counter supplement commonly used to treat acid reflux and irritable bowel syndrome, that is IBS. It's made from a blend of herbal extract including peppermint, licorice root, and milk thistle fruit. One review of 12 studies showed that Iberogast is generally well tolerated and may help reduce symptoms of indigestion more effectively than a placebo. Furthermore, one animal study found Iberogast to be as effective as a traditional antacid at decreasing stomach acidity. It also hindered rebound acidity, which has increased in stomach acid once medications are stopped. So the summary is Iberogast is a herbal supplement that may help decrease stomach acid and relieve symptoms of acid reflux. At number 5, we have got probiotics. Probiotics are a type of beneficial bacteria found in the digestive tract. They play a key role in gut health and immune function. Some research has found that supplementing with probiotics may help decrease symptoms of acid reflux. For instance, one review of 13 studies found 79% of them observed that probiotics had beneficial effects on symptoms of GERD, including reduced regurgitation, decreased heartburn, and less stomach pain and nausea. One recent study found that taking probiotics may reduce the risk of gut flora changes caused by long-term use of proton pump inhibitors, PPIs, used to treat GERD. So, probiotics may help reduce symptoms of acid reflux and reduce the risk of treatment relapse When used with heartburn medication, probiotics may also help prevent changes in the gut flora caused by the PPI. Last but not the least is ginger, which is scientifically known as Zingiber officinale. It's a plant that is used as both a spice and herbal supplement. It's often used to soothe stomach upset and treat issues like nausea and indigestion. One small study found that taking 3 grams of ginger powder daily for 4 weeks improved several symptoms of indigestion, including stomach pain, belching, and feelings of fullness. Consuming high amount of ginger may also cause side effects and worsen issues like heartburn and stomach. So be sure to only use it and when directed. Ginger may improve symptoms of indigestion and help speed stomach emptying. So this is all about the 6 vitamins and supplements that can be used for GERD or acid reflux. So if you have symptoms persisting for 2 or more times per week, you must consult your doctor or your physician. At last, I would like to thank you for watching this complete video. Subscribe for more. Stay tuned. Goodbye for the next video.